Margaret, thank you so much for being here today.
Thank you for having me. And Jessica, so nice to be able to be here and share my work and what we do with you and your audience. Thank you.
Yeah, I'm looking forward to talking about it. So let's kind of start there. Tell us about the work that you do and what got you into it.
Sure. So I am a speech language pathologist, but the speech pathology field is very broad. So typically, when you meet a speech pathologist, they specialize in something.
Mhm.
And my specialty is feeding, swallowing, and myofunctional disorders. I work with population of all ages, including infants all the way through adults. And what I do with infants, a lot of times has to do with around tongue ties and difficulty breastfeeding, bottle feeding, things like
Mm.
that, any oral dysfunction. And we go into children that have any speech language delays. Um, and then later on for adults, I work with TMJ issues for adults, any mouth breathing, sleep apnea, all those kind of things related to any kind of oral dysfunction, breathing pattern dysfunction, swallowing difficulties, anything like that.
Is there anything that got, so this is fascinating. I did not plan it this way, Margaret, but a friend, a functional or an integrative nurse practitioner friend told me about the book Breath by James Nestor. Don't quote me on it. You're not, yeah. And in that book, obviously he had a personal experience that got him very curious about all things breath work.
Mhm.
Is there something that's the thing that got you into? Because I'm jumping ahead. You haven't even mentioned this, but what I know about you is that breathing is an integral part of this. So before we get into that though, is there something about like what is there something particular that got you into this field?
Yeah, well, I was a speech pathologist before I got into myofunctional breathing and that's kind of specialty. So when I graduated, I worked for hospital system and I did specialize in feeding and swallowing disorders. I came from working with head and neck cancer patients and
Mhm.
anything that had to do with swallowing, even for people that had strokes. So any swallow dysfunction, that's what I did. But then I had my own kids, and my middle son at that point was really struggling. And it kind of goes back to when he was an infant, when I kind of track back of kind of what he was presenting with before I knew any of this stuff, everything just falls into those patterns. But when he was about 4.5, when I was working in the hospital, I went to this course. I wanted to start working with infants. So I went to this course. I met Dr. Milton Gavelis, who is a tongue tie release provider in that area. And everything that he was talking during that lecture, it just described my son. And I'm like, oh my gosh, like this is everything that my son is dealing with. So I went to talk to him, and he's like, "Oh yeah, you have to bring him in." And so everything else is kind of history, but I
Mhm.
got my son evaluated and got him into airway centric orthodontist, and we figured out that the bottom line of everything that he was dealing with up until that point had to do with a tongue tie was kind of the source, but ultimately was his mouth breathing that contributed to his sleep issues, his learning issues, his behavior issues, his motor planning issues, and like all those things. So after I had that experience with my son, I went on this kind of journey, this rabbit hole down into the breathing, the myofunctional, the airway, all this kind of stuff. And then I couldn't do what I wanted to do with the knowledge I had in the hospital system. So I ended up leaving and starting my own practice. And that was back in 2018.
Okay. I mean, so you're dropping words like myofunctional breathing and mouth breathing. And so I want you to, first of all, unpack what is myofunctional breathing. And then I want to hear about, because you're talking about mouth breathing and behavioral issues. And I know there are people listening going, what in the world does our breathing have to do with behavioral issues? So we're going to go there. But first, tell us what that word myofunctional breathing is.
So myofunctional therapy or myofunctional disorders
Uh-huh.
is a myo meaning muscle, and functional is functional use of our facial and oral muscles. So anything that has to do with how you functionally use your face, your
Uh-huh.
facial muscles, and your tongue, your lips, your jaw, all of that. but it also goes down to breathing because breathing is going to be kind of the base of everything that we do, including how we talk, how we swallow, how we chew, and all of those things. So we can't ignore breathing. But with breathing, it also is the basis for everything. We can go days without food, we can go hours without water, but we can only go so long without breathing. And the problem is that we don't pay attention to the way we breathe. And it's such a crucial thing, especially when we talk about breathing while sleeping. So, mouth breathing is dysfunctional breathing. There is no such thing like I only occasionally breathe through my mouth or I breathe through my mouth whenever. It is there as a compensatory strategy. Um, our body is made in a way where we can, live with one kidney, right? Like compensate in some ways, right? So it's the same thing, but it's not a functional way to do it. And when we compensate in any way, there's going to be consequences related to it. So when we,
Yeah, keep going. I'm like, yes, clearly you can see my brain like racking up the questions. Keep going. Yeah.
yeah, so when we chronically breathe through the mouth, right, then that kind of starts to stack up and becomes a problem.
Mm.
Um, the problem is that, we do it without knowing about it because it majority of the time is something that we developed starting in infancy.
Hmm.
Whether it is because there's structural components, and structural components can be such things as tongue ties, lip ties, even buccal ties, which are tube ties, or could be because the baby is born with a jaw that's already smaller, that it's recessed. There could be other, genetic components that create a dysfunction in breathing when the baby is forced to breathe through the mouth. That's the only way they can do it. But if that is not picked up on and there's no resolution to it, what's going to happen is that baby is going to grow into a person that it has this dysfunction and it creates compensation as they grow. The biggest thing is that the way we breathe is going to guide the growth and development of the face. So we have to look at it from the perspective of the structure when the baby's born is going to dictate the function. So whatever structure the baby's given, now we're going to have to figure out how to function with it, how it, suck, swallow, breathe, and then later learn how to chew and swallow foods and speak and so on and so forth. But the function then directly is going to impact the structure of how the child's face continues to grow and develop.
Fascinating. Okay, so obviously I'm thinking of selfishly, I'm like, well, I'm an adult now, so how is this gonna how is this impacting us? And I'm listening into the when you said like chronic mouth breathing creates consequences. So what are, and again, I'm still curious about the you mentioned your son or children and behaviors. And so
Mhm.
what are some of these consequences of mouth breathing?
Yeah, so in children, especially in like development phase,
Huh?
right? Everything that the child has to kind of develop happens during sleep time, right? We practice these things during the day, but the actual learning part happens when we sleep. And it kind of same is for adults. However, for children, the problem is that when we're supposed to be learning everything during childhood, right? And then kind of you have these patterns and these behaviors and these memories be concrete while we sleep. These things don't really happen or are disrupted because of the way we breathe. So, number one function of your brain is to keep you alive, right?
Noted.
If there is a problem with the way you're breathing while you sleep, your brain's not going to be focusing on, oh, do you remember how to do the motor pattern for crawling? Or did you remember how to do the motor pattern of walking up and down the stairs? Or did you remember how to practice how you do your ABCs? It's not going to do that. It's not going to steal that information. What it's going to worry about, the brain, is to keep you alive. So it's going to open your mouth, extend your neck, flip you over, wake you up, do whatever it takes to keep you breathing and alive.
Mm.
Now, when all these things are taking place during night, then when the child wakes up, now you have a child that did not go in the REM. We did not detoxify, didn't create new cells, new programs, new patterns. And I'm saying like we did it, like we maybe did, maybe not, right?
Mhm.
Or these patterns or the processes that are supposed to be taking place during night are disrupted or not taking place at all, right? And it's hard to know exactly what's happening, but now we have a child that wakes up in the morning and it's tired and it's, moody and we can't regulate emotions. And what studies are showing is that for boys that are sleep deprived, because that's basically what it is, we have these kids that are sleep deprived. For boys, the symptoms can be more on the hyperactivity, the aggressive, kind of irritated, moods, like that kind of behavior. And on the girls' side is more of the emotional, the anxiety, the depression. That's the kind of difference between boys and girls and how, we deal with that. But that's pretty much what it is. It doesn't matter the quantity of sleep. Because I have, many parents that come in, we always check about sleep, right? And oh yeah, he's so good, or she sleeps 11 hours a night. Yet we got dark circles under the eyes. You can't keep them awake. They're falling asleep. We have all these kids that go in therapy because now they have problems with friends and they socially struggling, right? And nobody's checking. Are they actually sleeping? Quality versus quantity.
So what do you do if it's I mean, we've heard, I'm sure most of us listening have heard about the mouth tape and like and there's like controversy around that. So if someone has chronic mouth breathing while sleeping and that is disrupting the sleep quality, what's the antidote? How do you address it?
Yeah, I wish there was something universal like the mouth tape for everybody.
Uh-huh.
However, it's not that simple because everybody's reason for mouth reading is going to be different. It can be, that there is some similarities between, person A and person B. We do see the same characteristics in a lot of our patients, but how we address and how we treat is going to be completely different from patient A to patient B. And mouth tape is something that we do recommend for a specific type of a patient, and it has to be done under like a supervision or under care of a therapist that knows what they're doing. Because you can't go around and just tell people tape your mouth, because what if you can't breathe through your nose? If there are structural things, if you have chronic inflammation, then when you do tape at night, you are going to be stressing out your body even more. And a lot of these problems are going to then go against like cardiovascular system because you're constantly trying to breathe and you can't, and so you're putting a lot of stress on your heart. So it is something good. However, I do not agree with universally advertising mouth tape for everyone because it's not for everyone and it has to be done appropriately. And so if you are trying mouth tape, yet you don't know if you can functionally breathe through your nose, that's a problem.
It's a problem if you can't breathe. Listen, if everyone is listening, don't suffocate yourself at night. That's the moral of that story. Okay, so
Yes.
you've sort of talked to us about the childhood side of it, and obviously you're just talking about it now, but something you talk about is like something as simple as breathing can shape our health, our mindset, and so. What about for the adult? And what does poor breathing, and maybe not just maybe there are other type, maybe not just mouth sleeping and that sort of thing, but what else does that look like with poor breathing and how what the ripple effect that be on our energy, our emotions, our mindset?
Um, yeah, like where do I start?
Yeah.
Listen.
And sometimes you ask questions, I'm like, I don't know if that's a huge question. That might be a huge question.
It's a loaded question, and
Uh,
there's a lot to it because mouth breathing is going to affect us on every single function,
mhm,
structure, of your existence, pretty much.
mhm.
So let's start.
Okay, hold on. Maybe pause.
Mhm.
Like, if I asked
Yeah,
a
yeah.
huge question, maybe let's pause here. So I'm like thinking, let's break this down. Like, one, how does somebody know if they're mouth breathing? Maybe. And as I was like thinking that question, I was thinking, like, this morning, I'm training for a half marathon. So I'm
Mhm.
out running this morning and I'm listening to this breath book by James, I think it's James Nestor. And
Nesser.
and I'm like, well, okay, so should I be? should I have my mouth closed while running? So I was trying that. I was like, is this a good idea? I don't know, but I haven't gotten to that part of the book yet. But when we say mouth breathing, and is this something like throughout the day to be mindful of? Like, I mean, is the idea that because you said this is a compensatory behavior. So is it that we like technically we should be I hesitate using the word. We don't use the word should in my business, but is that what how we're designed is to breathe through our nose
Yes,
primarily and not
100.
is everyone else
Yes.
listening? Does everybody else know that? Is this a commonly known thing? I the only person who's like, is that what we're supposed to be doing? So if I'm out running, am I
Mhm.
technically would it serve my body more if I'm breathing? I run with my mouth closed. Yes.
Yes. But
She's
even
shaking her head. Yes.
but before running, just if you're just sitting there,
Huh.
right? So whenever you're not talking or eating, your mouth should be closed and you're breathing through your nose. And not only that, your tongue should be resting suction on the roof of your mouth.
I'm doing it right now. Everyone do it. It's like I just had thought it's like when everybody talks about doing Kegels, suddenly we're doing them. So immediately you're doing this. I'm like, okay, my mouth is closed. Okay.
Yeah, and
And
your
I love
your
what you
tongue
said.
should be. Mhm.
Anytime you're not talking or eating, close your mouth. I feel like this would serve us in being better listeners also. But close our mouth, tongue on the roof of my mouth.
Yes. And then going back to what you said about running and breathing, we are nasal breathers by nature. That is it, right? There, and we can talk about nasal breathing benefits and all that. You could probably, you're reading all that stuff in James Ness's book. But what happens is, and going back to when you were talking about how do we know if we're mouth breathing, the biggest you can be a mouth breathing during the day and you can be an or you can be a nasal breather. I'm sorry, you can be a nasal breathing during the day, but you can be a mouth breather at night, which is also not good, right? Because night is something that we care more about than during the day, even though both are important.
Mhm.
So one thing that you want to look at is, does your mouth get dry? That is one indication. Number two, do you have chronic nasal congestion, nasal inflammation? Do you have allergies, things like that? Number three is going to be, do you always like, and we do some things subconsciously without realizing why we're doing it. That do you always need a glass of water by your bed?
Yes.
Okay. So now, then other things is, do you have any TMJ issues? Do you have any trouble swallowing? Do you get headaches, headache migraines? Those also hand in hand with chronic mouth breathing. Things like that. That will be the first signal for adults if they're mouth breathing. Another thing is when you exercise, how difficult is it, and especially when you do cardio, how difficult is it for you to maintain nasal breathing? There's going to be some point, especially if you're like working extra and you're increasing your heart rate, because heart rate and breathing rate go hand in hand. You increase one, the other goes up, right? And you decrease one, the other goes down. So when you're working out and you're increasing your heart rate because you're doing cardio, like running, how difficult is it for you to maintain nasal breathing? And at some point, you will have to open your mouth because your heart rate is going to be too high and your body feels like it's going to feel like you're not breathing enough. So it's fine, but that is a short-lived moment, and then you go back to nasal breathing. However, if you are interested in also training for marathon and doing work like that, another great book is Oxygen Advantage by Patrick McKeon, who is the teacher of Buteyko method. And so
Of what method?
the Buteyko method, so it's a breathing re-education technique. And what happens is he definitely recommends nasal breathing, but we also do things like pausing and hold breath while you exercise. He specializes in training military and high performance athletes with these methods that simulate altitude training. So when you work through like the different techniques that he has, right? You're increasing your resilience for exercising, you're increasing your ability to outperform other people that are mouth breathing, right? Or have dysfunctional breathing patterns. And then not only that, but you also have all these other health benefits through increasing your nitric oxide in your system.
Tell us everything. But I just want to say, as you said, like dysfunctional breathing patterns. I think a lot about like well-being and people's life, but like what I don't think about is dysfunctional breathing. I don't think about that. So how do we know that we are dysfunctionally breathing? Like what is that? Paint us a picture of what does dysfunctional breathing look like? What does ideal breathing look like? And how do we practice more of that?
So dysfunctional breathing is going to be one that is visible, number one. So anybody who, shoulders go up, the chest rises, like all that. Number two is it's audible, like you can hear the person breathe, right? And then the biggest one is going to be whether it's mouth or nasal, right?
Mhm.
So mouth breathing is going to be that dysfunctional. Functional breathing pattern is going to be a diaphragmatic breathing. Okay, so using the diaphragm to draw in that air, okay, all the way down into your lower lobes of the lungs. That's where the blood is, majority of the blood is. So when we bring in that air, we can supply all that oxygen to the blood. And then it's going to be a breath that is not visible, right? So you should not be seeing we should not be seeing you breathe. And then it's going to be quiet. So if you're sitting next to somebody that you can hear them breathe, right?
So the next time
It,
you're on a plane, friend, we should just really like, hey, sir, have you tried mouth nasal breathing?
yeah, yes.
I'm just kidding. Do not do this. We
Mhm.
don't invite our friends unless invited. Don't offer advice
Yeah.
to strangers on
And
the plane.
then, yeah, and then nasal breathing, right? So we want to make sure that the breath is invisible, quiet, and through the nose. That is
Mm.
functional breathing.
Okay, that's easy. Invisible, quiet, and through the nose. Got it.
Mhm.
Now,
Yeah.
because most of us need incentives, we don't like to just follow rules for the fun of it. We want to know what's in it for me. So if we do functional breathing, what are the benefits? What's the upside? What might we notice different?
Yeah, the biggest thing is going to be proper oxygenation of your blood, and most importantly, oxygenation
That's
of
all.
your brain,
Uh-huh.
right? So when you can do the three, right? Quiet, invisible, and nasal, you are going to be forced to do it slow, meaning that you're
Mhm.
going to be reducing your breathing rate. So your inhale is going to be longer, your exhale is going to be longer. Ideally, we want to be breathing on a cycle of 6 seconds in, 7 seconds out. So 6 seconds in, pause at the top, 7 seconds out, pause, and then start over, right? So that is an ideal breath cycle. So when we breathe like that, we allow the body to take in the oxygen, and we also, so let me ask you a question. Do we know why we breathe? What's the point?
To stay alive, to oxygenate ourselves.
Right. So most people would say to get the oxygen, but
Yeah.
it's right, but it's actually to release carbon dioxide. That's the primary driver of a breath, is to release carbon dioxide out of our system, which is the byproduct, right? Which is like the gas that we want to get rid of somewhat. But
Uh-huh.
we also know that carbon dioxide is crucial for proper oxygenation of our cells. So when we breathe too fast, when we breathe dysfunctionally, when we breathe through our mouth, we release too much carbon dioxide out of our system. Therefore, you can check my oxygen saturation and it can show 99, 100, but doesn't mean that my body is actually absorbing that oxygen if I'm breathing too fast. Because I need the carbon dioxide molecule to take in the oxygen, actually carry it into my bloodstream. So we want to make sure that we're slowing down our breath cycle to retain the proper amounts of carbon dioxide in our system.
Is there an ideal number? I mean, I know you gave me the math of six, pause, exhale, seven. So what does that equate to? Because I can't math that fast. Is there a certain number of breaths per minute that, sort of like when we think about resting heart rate and beats per minute, what's
Yeah.
the breath per minute?
Yeah, so we definitely want to be under 20. We definitely
Okay.
want to be under 20 breaths per minute. Yeah, and that would be ideal. When you think about the benefits of it, when you start breathing slower, your body calms down. You regulate your nervous system. You're not anxious, right? When we get worked up about something, right, what automatically happens? You start breathing faster, and you may do start doing that too, right? Because
Hmm.
we feel like we need to breathe so much air in. But we can control the breath. That is something that we can control. So when you slow down, close your mouth, breathe through your nose, you automatically are going to regulate, bring your anxiety down or, whatever it is, that's kind of working up, right? So that's one benefit of it. And then, or another benefit of it. And then thinking about sleep, when we have proper functional breathing during the day, that is also going to translate to nighttime. Majority of the time, like I said,
Okay.
sometimes you can have almost good breathing during the day, but yeah, have dysfunctional breathing during nighttime. But majority of the time, this is what we do during the day is going to also be the case what we do at night. And when you breathe properly at night, you are going to have quality of sleep. And that
Mm.
is right, that is when the detoxification of your body happens. And that is a big thing for adults. Think about all the stuff that we're exposed to. They're trying to kind of kill us from all directions. The
We are
air, the
under
water,
attack.
the water, the food, the stuff that we put on our bodies, like everything, right? So we have to be going through detoxification processes on a daily basis to be able to just kind of keep up with all of that, right? Another thing is hormones, all the hormonal things. Here's the question, what happens first, chicken or the egg type of a situation? Do we have weight gain first, or do we have sleep apnea first?
Mm.
Because a lot of times it's like we're looking at these men over 40 that, have sleep apnea and they also happen to be a little overweight, but which one happened first? When we don't sleep right, then we're going to be more prone to reach for sugar, drink more coffee. We're going to be less motivated to go
Mm.
work out. Do you see where,
Yeah,
right? See
we
the
see the
pattern,
cycle.
right? And then we get into the sleep problems that is more visible. Now we're going to be going into we actually are stopping breathing at night, and now
Snoring?
you're
That,
snoring. Yeah, your wife is like, you're snoring, you need to go to, see a doctor. And the doctor says you need a sleep apnea machine, but nobody
Mhm.
checks why do you have sleep apnea in the first place, right? So that is kind of
I
the
just
the
want to like
cycle.
pause here and just say, here's what I find fascinating about, and this is what my integrative nurse practitioner friend was talking about, is that health wasn't meant to be so complicated, right? And what I love about what you're talking about is whether it's like detoxing from all of the toxins of the world, your breath is like forget about all of the like all of the things that people do to try to detox and all the extra work, like or practice breathing invisibly, quietly, slowly, and through your nose. Right? Like that's gonna help you sleep well and your body's gonna detox. Like I just love this reminder that our bodies are created for healing and for vitality. And sometimes it's the simplest thing that is so overlooked. When is the last time I can speak for myself? When is the last time I thought about my breathing? Only when I'm running, right? Only if I can't breathe, right? Or like when we're stuffed up from being sick, right? Otherwise, I don't think about it. You're breaking my brain here, Margaret. This is great. So we detox, great hormones. And listen, as a 44-year-old woman, we're venturing into this land, and I know a lot of people listening are thinking about their hormones, men and women, right? And so you kind of talked about sleep apnea and weight gain, but are the other benefits, like when you think about breath, what's that relationship between breath and sort of balancing or calibrating our hormones?
Yeah, and because of this, the disruption of the processes that take or are supposed to take place during sleep.
Because
And
that's where
if
our hormones are they're breeding in our sleep.
everything should be balancing out during sleep. And if you were to look at pretty much, I'm almost certain that if I did uh, pretty like thorough research on this, it's going to be every single chronic disease that we have is some way related to the way we sleep. And then sleep's going to be related to the breathing. So, starting with high blood pressure, diabetes, thyroid problems, like all those things, even talking about like dementia and Alzheimer, and talking about even down to cancer, because all of that is going to be um, directly impacting your body's ability to fight in inflammation, right? So when you're not sleeping properly, your inflammation markers are going to be increased, right? So
Fascinating.
yeah, there's also a study that shows, and I should have looked that up before we came on, but there is a study that says if you are a mouth breather, how much more your healthcare, how much more expensive your healthcare is. And I don't have that number, but you should look it up. And it's crazy difference between a nasal breather and a mouth breather, the difference of like healthcare problems that you may end up having if you are a chronic mouth breather.
Fascinating. So, so I know that probably another big question, but I know you were sort of saying like, don't just do universal things. Like, not everyone listening, the answer is not to go out and buy mouth tape right now. But when you think of for kids and adults, like I know I've heard parents say like, oh, my kid's a mouth breather, and just sort of like offhandedly. And now I'm hearing that completely differently. And so, are there things? Like, is this something, let me ask you though, is it something where if you're a mouth breather, are there things that you can do sort of at home on your own that don't require, to be under the care of a speech pathologist or a related provider? And then maybe how do we know if just at home remedies are not going to be enough and like you might need to seek professional care?
So the first thing is going to be determining whether or not you or your child can breathe through the nose. So there, you could do a water test, which just take a sip of water and hold it in your mouth for 3 minutes. So for yourself, if during that 3 minutes, if at any point you feel that you're starting to get anxious, you're starting to feel like you can't hold it any longer, you have to swallow or spit the water out, and you just can't make the 3 minutes, that's a problem. So there is dysfunction in your nose, right? And your body is not going to be okay with you just nasal breathing. That is a person that should definitely not be mouth taping at night.
Okay.
For
If
your
you heard
child,
nothing else, friends, make sure you underline that part. That's a great hack. Got it.
for your child, you do the same thing, but you're watching their facial expression. And
Mm.
if they're like at any point you see them being kind of at distress, or they're gonna spit it out, or they're like, I can't hold it any longer, or something like that, right? That's another example. They can't functionally breathe through their nose. And so now we have to see what the problem is. So are you prone to allergies? Okay, is that under control? Do you have pets in your house? Even if your pet is hypoallergenic, you could still be sensitive to the dander that the pet releases, right? So that sometimes creates irritation, inflammation in the nose. So you have to make sure that that is taken care of. If you have chronic congestion in your nose, you can start using some nasal sprays, and there's all kinds of good over-the-counter, not medicated. I recommend xylitol-based nasal sprays to start off with, or using like a neti pot and just doing saline rinses. Do it twice a day, morning and night, and see if you can get your nose to be functioning. Nasal breathing kind of follows the principle of use it or lose it. The more,
Mm.
more, the more mouth breathing you're doing, the less functional your nose is. So it takes that retraining, but you also have to make sure that your nose is not blocked, right? There is not, all kinds of mucus or whatnot in there where you can, breathe functionally. Another thing is if you, let's say, you've done 2 weeks of nasal clearing, your allergies under control, and everything you've tried that I'm recommending, and you still can't pass the water test, there might be a problem with structural components in your nose. So a deviated septum and large turbinates, things like that that would require an ENT scope and potentially some surgical intervention, just really depending on what it is.
Okay.
That makes
So
sense.
if we have figured out we can breathe through our nose, we can nasally breathe safely, then would the recommendation be tape your face shut or your mouth or your lips? Yeah.
You could do that kind of in. as you're retraining because we don't want to be taping for the rest of our life. What we want to
Yeah.
do is retrain tongue posture. So remember I said
Okay.
when you close your mouth, your tongue should go suction on the roof of the mouth. When your tongue is suctioned to the roof of your mouth, you can't mouth breathe.
I'm te I'm
You know
testing
what
it
I
out.
mean?
Confirmed. Everyone, let's do it together while you're driving in your car listening to this.
Yeah.
Mm-hmm.
Right?
Mm-hmm.
There's no way you can breathe through your mouth. And that is important not only to maintain nasal breathing at night, but also the suction on the palate keeps your tongue away from the airway. So when your tongue is not suction on the roof of the mouth. When you go to sleep, the tongue falls into your airway. That's why we have the sleep apnea, the obstructive sleep apnea, because a lot of times the tongue is blocking the airway. So we're gonna kind of suck in the air and it's gonna collapse, the airway is gonna collapse on itself, and then therefore creating that apneic event.
Okay, so I
And
don't ever think about like working out my tongue also. But
Mhm.
if I'm hearing you correctly, you're saying if we train our tongue throughout the day to go to the top of the mouth, then when we sleep at night, it should do that.
Exactly.
Uh-huh.
Yes. And so you have to remember also the tongue is a muscle. Actually, it's 16 muscles combined, right? So compared to relatively to its size, is the strongest muscle in your body. And so especially as we age, right, you work out your legs, your arms, your abdomen, but
Yeah.
nobody ever works out their face
Never
muscles,
one time. Yeah.
right? So
But right now. Mm.
yeah, so you definitely doing some exercises for strengthening and toning your tongue would be beneficial. But the
L-
biggest thing,
Like what? Like what are okay, other than putting my tongue on, I know you're about you're like telling something else, but what there are tongue exercises. Did we just YouTube this? I need to see it. I need this is gonna be hysterical.
and the thing is
What do
too
you
is
think?
like I hesitate with like showing different exercise because not every exercise is appropriate for everyone, and it's
Uh-huh.
also going to be so individualized. Like let's say I can show you an exercise, but it might not be appropriate that for somebody who is dealing with some TMJ. So I wouldn't want that person to be doing that exercise because they could be making their TMJ worse. So that's why
Gotcha.
that individual care and that like supervision with a trained therapist is so, so important.
I just
So I
need
know,
one example, Margaret, because now my brain is like, what are you doing? We're doing push-ups. We're doing tongue curls. Like, what is this? Uh-huh.
yeah,
What is an
you could do
exercise?
tongue clicks.
Oh, so the stuff we did as a kid when we just were like sitting around.
And so that's when you can do tongue clicks.
Uh-huh.
Making sure that you're not compensating with your neck, because I saw your neck
Oh, was I doing
automatically
that?
going with it.
Oh, good. See,
Yes.
this is why we have trained professionals, friends. Mm-hmm.
hmm
Okay.
Yeah,
Go
another thing is
straight.
suction your tongue up and hold it for 2 minutes. See if you can hold it for 2 minutes.
Mm-hmm.
Just like that, right?
Yeah. Just
Yeah.
change it. Y'all, we're just redefining your exercise regimen. Just don't forget after you stretch, also do those tongue presses.
Yeah, and there's the thing is that there are all kinds of different gadgets, and if you start looking into it, they try to sell you like this water bottle that trains your tongue, this jaw exerciser, and uh, it it can be good. However, if you don't know what you're doing, it can cause more harm than good.
Yeah.
That's why
Love
I
the entrepreneurial
hesitate to.
spirit. They're like, you need a tongue bench press. Here, I got a thing for you.
Yeah, so same like with this mouth tape, right?
Yeah.
It's marketing, will do its thing, but it's not for everyone. So,
Mm.
people that are using it have to understand why they're doing it, what the point of it is, and if they're actually benefiting from it and not making it worse, their
Yeah.
health worse. So,
Well, obviously, I could ask you for, who knew that you could talk about breathing for 40 minutes, but here we are. And I could keep asking you questions, but for the person who's listening who's like, I think I have something going on with this, or I know, or my husband snores. I know there are tons of people like, hey, I better forward this episode to people that I know. But if they are like they're hearing this for the first time, like what's the one step that you would encourage, like whether it's something they need to look up or research or ask their doctor about, or an exercise to start doing, what would be the one thing that you'd say, here's where you can get started if you would like to improve, if you would like to take a step towards functional breathing rather than dysfunctional breathing, what might that be?
Yeah, so definitely do that water test first and determine if you can breathe through your nose.
Mm-hmm.
Then majority of people, I can safely say that we don't have functional breathing patterns, as meaning like that breath cycle. So
Mm-hmm.
practicing that slow, quiet, diaphragmatic breathing is super great. You can do like guided breathing practice, what it forces you to slow down your breathing, put your hands on your belly. The best thing to do,
Mm-hmm.
the best way to do it is when laying down. It helps to, the gravity helps to keep your chest down, and then you can feel if you are raising your shoulders against the bed that you're laying on. So laying down, put your hands on your belly, make sure that that belly rises and falls with your breath in, breath out,
Mm-hmm.
uh, and then that your breath is quiet and practicing that slow breath.
Yeah.
Uh, and so that is one thing. And then making sure that we're also watching inflammation. So the diet's going to have an impact. If you are eating something that your body doesn't like, you're going to have nasal congestion. You may have buildup of phlegm and things like that. If you clear your
Mm-hmm.
throat all the time, that's an indication that you have some inflammation that your body is like constantly trying to fight with. So that's another thing. If in children, if they have tonsils or adenoids that you went to ENT because they were sick or something, and the ENT said, "Oh, you need their tonsils and adenoids removed," that is actually not true 100% of the time because I am of a belief that we're not made with spare parts. And there's a reason why those are enlarged, and it's because of inflammation. And we have a study that shows that when we improve nasal breathing, those can reduce, kids don't need surgeries. But definitely looking into, for kids especially, but there's also treatment for adults, looking into airway-centric orthodontics. If you have a
Mm-hmm.
child or if you're an adult and you have crooked teeth or if you had braces as a child, you have a myofunctional disorder 100% of the time. Um, so yes, and especially
I
when
never had braces. I would like to report that somehow this might be the one dysfunction I didn't get. Okay.
Yeah, for adults that require permanent retainers in the back of their teeth because every time they go to their orthodontist and says, "Oh, you're making your teeth worse" and stuff like that, right? It's because you're swallowing incorrectly. You probably are not breathing the way it's supposed to. You're chewing your food incorrectly. All of that is going to have an impact. But the crooked teeth started because the jaw and the face did not develop properly. We're meant to have 32 teeth. We're not supposed to be taking out teeth. We're not supposed to be needing braces, and majority of the population needs braces.
Mm-hmm.
So that's the problem. So looking at airway-centric orthodontists, looking at early intervention. We have kids in expansion and some sort of, devices as early as 3 years old. And there's other things that we could be doing even before that to promote facial growth, development of, if you think about the roof of your mouth is the floor of your nose. So if the roof of your mouth is going up and high, it's going to block your nose. So we want to make sure that we're promoting that proper growth so that they can be nasal breathers, right? So that's one thing. Airway centric orthodontist, and not every orthodontist is airway centric. So that is a very key term that you want to be looking up. And then majority of times you will want to work with a speech pathologist who is trained in myofunctional disorders. Not every speech pathologist is a myofunctional therapist. So that is another thing that you want to be looking out for.
Okay, well, before I let you go, Margaret, please tell people where they can find you and connect with your work, because I'm guessing people are going to have loads of follow-up questions that I will have no answers to, but Margaret, you just might. So where can they connect with your work and follow the important work that you're doing in the world?
Yeah, so our clinic is located in the suburbs of Chicago in Crest Hill, Illinois.
Mhm.
But you can find me on Facebook and Instagram. My website is mytherapywellness.com, and my practice is Advanced Therapy and Wellness Center. So if you put that in a search in Instagram, Facebook, and TikTok, our pages should come up there. So we always post educational things, and so you can find more information about those things. But I also have connections throughout pretty much the entire country and even some in other countries from all the conferences and things that I attend and do for my continuing education. So if there is anyone that needs a therapist or a recommendation for a provider in their area, I'll be, glad to connect them if I have a contact. If not, just kind of give them some guidance of how to find somebody in their area. So my email address is Margaret at mytherapywellness.com. So everybody feel free to email me.
Write that down. Amazing. I appreciate this. Like I think of breath work in a whole different light now. Like my insight timer hates to see me coming now for some breath work because I thought about it in terms of yoga and relaxation. I never thought about it from the speech pathology and nasal wellness and detoxing my body. And so you are opening up a whole new world for me, Margaret. And that's why I do this, getting my brain unblocked. So thank you so much for being here today. I appreciate it. And I can't wait to hear what the listeners are, what their takeaways are from today's episode. Thank you for being
Yeah,
here.
thank you so much, Jessica. I appreciate the opportunity and yeah, looking forward to all the questions.
Great.